A 25-year-old male presented with a growth in the left atrium. Now, diagnosis is A. Rhabdomyoma, B. Myxoma, C. Metastasis, D. Papillary elastosis. 25-year-old male presented with a growth in the left atrium. What is the diagnosis? A. Rhabdomyoma, B. Myxoma, C. Metastasis. Now, left atrium, they have given a clue in the question. The left atrium has been opened here. You can see in the image. And most common primary cardiac neoplasm is an atrial myxoma. These are benign masses, most often attached to atrial wall. They can produce a ball valve effect by intermittently occluding the atrioventricular orifice. Sometimes they can intermittently occlude the atrioventricular valve orifice. So the correct option here is B, myxoma. A 45-year-old male presented with a pulseless disease. On examination, following histopathological finding will be seen. What do you see here? A. Granulomatous vasculitis. B. Fibrinoid necrosis. C. Leukocytoclastic vasculitis. D. Thromboangiitis obliterans. A 45-year-old male presented with a pulseless disease. On examination following histopathological finding will be seen. A. Granulomatous vasculitis. B. Fibrinoid necrosis. C. Leukocytoclastic vasculitis. And D. Thromboangiitis obliterans. Well, it is granulomatous vasculitis. It is granulomatous vasculitis. Here you can see epithelioid cells and giant cells, suggesting of granulomatous vasculitis. Granulomatous vasculitis is seen in giant cell arteritis, Takayasu arteritis, Wegener granulomatosis, Churg-Strauss syndrome, and Buerger's disease. So it is granulomatous vasculitis. Our correct option is A. A 15-year-old boy presented with pancreatitis. On myocardial biopsy, following finding was seen. Diagnosis is A. Aschoff nodule, B. TB, C. Foreign body giant cell, D. None. Well, what do you see here in the image? Here you can see a collection of foci of swollen eosinophilic collagen. Swollen eosinophilic collagen surrounded by lymphocytes, primarily T lymphocytes, occasional plasma cells, Aschoff giant cells, Aschoff cells. These Aschoff cells are the macrophages of rheumatic fever, and anti-Schwab cells, cells with caterpillar-like chromatin marked with an arrow. So here you can see a foci of collection of swollen eosinophilic collagen. So it is Aschoff's nodule. Factor responsible for cardiac hypertrophy is A. ANF, B. TNF alpha, D. C. CMYC, D. TGF beta. Now the factor responsible for cardiac hypertrophy is cardiac hypertrophy. The molecular changes include expression of immediate early genes, that is FOS, GEN, MYC, and EGR1. So here the correct option is MYC. Bulky friable vegetations are seen in bulky, friable vegetations are seen in. Bulky, friable vegetations are seen in infective endocarditis. Heart begins to beat in dash week. A. Fourth week. B. Fifth week. C. Sixth week. D. 7 weeks. It is fourth week. Heartbeat begins with by day 22 post ovulation and can be detected by Doppler ultrasound. It is week 4 post ovulation or fertilization and week 6 from LMP. So it is week 4 post ovulation. Absence of conotruncal septum. Absence of conotruncal septum gives rise to A. Tetralogy of Fallot, B. Patent truncus arteriosus, C. Transposition of great vessels, D. Coarctation of aorta. The absence of conotruncal septum gives rise to patent truncus arteriosus. While measuring blood pressure of a cardiac tamponade patient, what advice you will give him? A. Hold the breath. B. Hold the breath. B. Breath normally. C. Long and deep breathing. D. Short and shallow breathing. To measure pulses paradoxes, a manually operated sphygmomanometer is employed for blood pressure measurement in the standard fashion, except that cuff is deflated more slowly than usual. During deflation, the first cortico sounds are audible with heart beats occurring only during expiration. With further cuff deflation, corticosteins become audible on all heartbeats throughout the respiratory cycle. The difference between systolic pressure at which first cortical sounds are heard during expiration and the pressure at which they are heard throughout the respiratory cycle quantifies the pulsus paradoxes. Severe pulsus paradoxes, variably defined as more than 10 to 20 millimeter of mercury, can be palpated in the radial, brachial, or femoral pulses, as well as a weakening or disappearance of pulse during the inspiration. Since the depth of respiration influences the severity, the patient should not be instructed to change his or her breathing pattern during his evolution. So he should be advised to breathe normally. Name syndrome includes all except A. Nevi, B. Atrial myxoma, C. Myxedema, D. Ephilips. Now, what is name syndrome? Name syndrome is Nevi, A. Atrial myxoma, C. Myxoid neurofibroma, and Ephilips. Now, what is Lamb syndrome? LAMB, Lamb syndrome. Lamb syndrome, L for lentiginous, A for atrial myxoma, and atrial myxoma, and blue neve. Atrial myxoma and blue nevi. This is name syndrome, Lamb syndrome. What is Carney complex? Carney complex include myxoma, cardiac skin or breast, lentiginy and or pigment nevi, endocrine overactivity, primary nodular adrenal cortical disease with or without Cushing's syndrome, testicular tumors and or pituitary adenomas with gigantism or acromegaly. So the correct option here is C. It is not myxedema. M for here, myxoid neurofibroma and not myxedema. Cardiomyopathy neutropenia syndrome is also called as A. Pompey's disease, B. Barth syndrome, C. Holt-Oram syndrome, D. Fraser syndrome. Now, this BTHS, that is Barth syndrome, is widely regarded as a rare X-linked genetic disease characterized by cardiomyopathy, skeletal myopathy, growth delay, neutropenia, increased urinary excretion of 3-methyl glutaconic acid. Barth syndrome is widely regarded as a rare X linked genetic disease characterized by cardiomyopathy, skeletal myopathy, growth delay, neutropenia, increased urinary excretion of 3-methyl glutaconic acid. So the correct option is B, Bar syndrome. Cardiomyopathy may be seen in all of the following: A. Duchenne muscular dystrophy, B. Friedreich ataxia, C. Type 3 glycogen storage disease, and D. Alkaptonuria. The correct option here is it is alkaptonuria. Alkaptonuria. The neuromuscular disorders associated with cardiovascular involvement are Duchenne and Becker's muscular dystrophy, myotonic dystrophy, Friedreich ataxia. So the correct option here is D. Alkaptonuria. Causes of hypokalemic metabolic alkalosis with hypertension is the causes of hypokalemic metabolic alkalosis with hypertension is A. Liddle syndrome, B. Bartter syndrome, C. Gittelman syndrome, D. All of the above. Now let us look into all of the syndromes. In Bartter syndrome, there is adequate. Now let us look what is Liddle syndrome. Liddle syndrome is an autosomal dominant. There is hypokalemia, low renin, low aldosterone, mutation subunit of epithelial sodium channel, SCNNB and SCNN1C. Liddle syndrome is an inherited form of low renin hypertension transmitted with an autosomal dominant pattern. The molecular basis of Liddle syndrome is associated with abnormal function of epithelial Na plus channel, increased expression of channel at the distal nephron, apical membrane with subsequent enhanced renal sodium absorption. The most common clinical presentation of disease is early onset hypertension, hypokalemia, metabolic alkalosis, suppressed plasma renin activity, and low plasma aldosterone. The treatment of Liddle syndrome is based on administration of ENAC blockers, that is amiloride and triamterene. Now, what is the treatment of Bartter syndrome? Adequate hydration and potassium supplements along with indomethacin. Gittelman syndrome, give magnesium 50 to 100 milligram per kg per day. Liddle syndrome, amiloride and triamterene inhibit ENA plus C channel. Bartter syndrome type 4 is inherited human condition characterized by severe renal salt wasting and sensory neural deafness. The causal gene BSND encodes bartrine, an accessory subunit of chloride channel located in kidney and inner ear. Bartter syndrome and Gittelman syndrome are autosomal recessive disorder characterized by hypokalemic metabolic alkalosis, secondary hyperreninемia, hyperaldosteronism. So the correct option here is Liddle syndrome. Precapillary pulmonary hypertension is defined as A. PAP 25 more than equal to 25 millimeter of mercury, PCWP more than 15 millimeter of mercury. So the correct answer here is PAP more than equal to 25 millimeter of mercury and PCWP less than equal to 15 millimeter of mercury. Which of the following should be initial investigation in a patient with high likelihood of pulmonary embolism? A. D-dimer, B. Chest CT, C. Pulmonary angiography, D. VQ lung scan. The correct option here is D dimer. A 30-year-old male presents with complaint of chest pain since 2 days to emergency room with the following ECG. Identify the ECG. A. Left main occlusion. B. LCX occlusion. C. Acute pericarditis. D. Acute pulmonary embolism. There is a diffuse ST elevation in all leads. The ST segment is upward and PR segment is depressed. T wave inversion with or without ST segment depression. So the correct option here is C, acute pericarditis. Identify the condition given in the ECG. A. PSVT. B. Sinus rhythm. C. Atrial fibrillation. D. Ventricular tachycardia. It is an atrial fibrillation. Why? Can anybody comment in the comment box, please? Condition given in the ECG. A. PSVT, paroxysmal supraventricular tachycardia. B. Sinus rhythm. C. Atrial fibrillation. D. Ventricular tachycardia. This is atrial fibrillation. It is the most common arrhythmia characterized electrocardiographically by low amplitude baseline oscillation, that is fibrillatory waves, and an irregular ventricular rhythm. So this is atrial fibrillation. What is the most likely diagnosis of following ECG? A. Ventricular bigeminy. B. Electrical alterance. C. P. pulmonale. D. Improper calibration. Well, it is ventricular bigeminy. ECG shows normal sinus rhythm with ventricular bigeminy. Every other sinus P wave is almost likely hidden in the PVCs and not conducted due to refractory state of ventricles after PVCs. How do you recognize PVCs or premature ventricular complexes? There is an abnormal shape QRS, generally more than 120 millisecond. T wave opposite to major QRS deflection. QRS is not preceded by premature P, may be preceded by non-conducted sinus P wave. So the correct option here is ventricular bigeminy. Sustained ventricular tachycardia is defined that persists for A 10 seconds, B 15 seconds, C 20 seconds, D 30 seconds. The occurrence of three or more ventricular premature contraction complexes with a rate of more than 120 beats per minute in succession is called ventricular tachycardia. Non-sustained is termination of ventricular tachycardia by self less than 30 seconds. Sustained ventricular tachycardia is presence of ventricular tachycardia for more than 30 seconds or hemodynamically unstable. Identify the following ECG. Here you can see A, B, and RT. Identify the ECG. It is a second degree Mobich type 1 block. Which of the following murmur increase with standing, which is HOCM, hypertrophic cardiomyopathy? Which of the following antiarrhythmic drug can cause the ocular changes in the picture? It is corneal microdeposits caused by amiodarone. Which of the following drug is contraindicated in patients with given angiogram? It is captopril. Dofetilide is which class of antiarrhythmic drug? It is class 3 antiarrhythmic drug.